Welcome, good afternoon, and thank you for joining our panel discussion titled Building a Health Literacy Statewide Coalition, Lessons Learned from 5 States. My name is Marianne Nicolai, and I will be moderating this discussion. My background is in working with adults with chronic health conditions through development of health education programs, materials, and community outreach. And I am the current president of Ohio Health Literacy Partners. I'd like to start by introducing our panel today. Greg O'Neill is the Director of Patient and Family Health Education at Christian Care. Greg is also the Chair of the Health Literacy Council of Delaware. Karen Kamandor is founder and president of Health Literacy 360. She is a founding member of Ohio Health Literacy Partners and has served as our first president. Doris Ravitas is Professor Emeritus at Western Michigan University, and she's the coordinator of the Michigan Health Literacy Collaborative. And then we have Dr. Janelle Lamont in the yellow there. Dr. Lamont is a health disparities researcher and a health literacy and strategic communication specialist. She is assistant professor with the Memory Keepers Medical Discovery Team at the University of Minnesota Duluth campus. Janelle is an interim chair of the Minnesota Health Literacy Partnership. And last but certainly not least is Dr. Therese Wagner. She is the assistant professor at the University of North Texas Health Science Center. She is the interim director and clinical executive for health literacy at Safer Care Texas, and she is the founder of Health Literacy Texas. Here's how our panel discussion is going to work for today. We'll have 25 minutes or so where I will be asking questions of the panel. That will follow with about 20 minutes of questions from you, the audience. As you have questions, please type them into the question box that you see on your screen. We'll conclude with some final thoughts from the panel as well as next steps. And we do have some exciting news to share with you. So let's get started with our questions to all of the panelists. Some health literacy organizations are nonprofits. Others are extensions of another organization, usually a literacy organization. And some are informal groups. Would each of you please tell me the type of organization that you're representing today, why you chose this type of organization, and what are the goals of your organization? And I think we'll start from east to west and across the country and start with Greg first.
Awesome. Thanks for having me. With 5 of us, this will be speed round answers for sure, so I'll do my best here. The Health Literacy Council of Delaware is essentially an offshoot of an existing network of statewide partners. Another term you could use would be coalition. I was advised early on in 2017 not to stand up an independent freestanding entity, but to utilize the existing infrastructure of health partners that already existed and was in place for other efforts throughout the state. The primary mission of our council is to create a common strategy and a set of interventions for the state to address health literacy needs. Is that succinct enough?
That's good enough. Yeah, Karen from Ohio. Turn your microphone on, Karen.
Sorry.
There you go.
You know that technology.
There
right?
you go.
Yeah. So Ohio Health Literacy Partners, or OHELP as we like to call ourselves, really started off as an informal group. I was doing some health literacy work in the Cleveland area, and down in Columbus, Dr. Sandy Cornett was really trying to work on some statewide efforts. We met at a conference that my organization put on in 2011, I believe.
Right.
So we met there and decided to join forces. So we had our first informal meeting down in Columbus in July of 2013. And it was there that we decided on our mission, which is to empower all Ohioans to make informed health choices. So that mission then informed our goals, which are threefold. One is to improve health literacy in communities across the state of Ohio. Number 2 is to enhance health professionals' health literacy competencies. And 3 is to provide strategies with supports and resources to improve health literacy in organizations. And it was in 2018 that we, as our collaborative kind of grew, we decided to apply for and received our 501c3 status. So we have a nonprofit status in the state of Ohio.
Okay. Dory, from Michigan.
Yeah, so we're an informal group. We've been around for a couple of years. Our goal really is to have health literacy all the time. In other words, have it incorporated into everything we do and have it not be kind of a specialized thing on the side, right? We really wanted to focus on collaboration. So we meet on Zoom we met once a month, and we were kind of sharing things that we have done in our work to build collaboratives, right? To collaborate with each other. And we did a lot of that over the last couple of years, but it's not been really sustainable. So to meet every month and have enough people to present things. So we're kind of reorganizing now, but we're still fairly informal.
Could you talk a little bit about how you're reorganizing? What are your plans for that?
So we're going to meet less often, and we kind of looked at what where we really want to focus. We got a planning group together and did a little strategic planning and decided we really still wanted to do a lot of networking and collaboration, but we really wanted to focus on professional development. And so we're going to work on doing some of that development of professionals over time.
Okay, thank you. Janelle from Minnesota.
Hi, yeah. So I'm representing the Minnesota Health Literacy Partnership as the interim chair. Alicia Elwood Odiambo, who sadly passed away in late March, she was one that established the partnership in 2006 as an independently funded program of the Minnesota Literacy Council. So it doesn't have nonprofit status. It's the fiscal sponsor is the Literacy Council. And our mission is to improve the health of all Minnesotans through clear health communication via 3 goals. 1 is to train healthcare providers about health literacy. 2 is to empower patients to ask for clear communication. And 3 is to share health literacy resources.
Thank you. Therese.
So we've had a lot of similar experiences to the rest of you, but similar to Karen, we had sort of an organic networking start, and there was a group of us that just got together and decided that we needed better support for health literacy in Texas. And so we developed Health Literacy Texas, which is a self-standing nonprofit organization. And we chose the structure to allow for nonpartisan membership, inclusive to all healthcare, academic, and community-based organizations, as well as individuals without a tie to any one entity in the state. But just knowing that we each had our own jobs that kind of would make us biased or might make someone else not want to join because it was housed at a specific organization. So our mission is to help create, support, and maintain statewide health literacy initiatives to reach optimum population health in Texas. And so we provide monthly educational sessions and annual conferences, but similar to others' experiences, we first jumped in trying to do more and realized that we weren't capable because we are all volunteers. So we had to kind of restructure and reel ourselves in. And so as a result, our vision or goal is to build a culture of health literacy across Texas. So kind of had to simplify that rather than be all health literacy to everyone.
Yeah.
Right.
I'm just a quick question to those of you that have started nonprofit organizations or whose organizations are nonprofit organizations. Was that a difficult process to do? Did you have legal help doing that, or did you do it on your own? Karen, I know OHELP is a nonprofit, state of Ohio nonprofit, and Therese, could you answer those questions?
Sure. So it is a rather complex ordeal to make that happen. Luckily, it was during the pandemic, so I had time at home to focus on that. I think in my real-time job today, I would not have that time to focus. So, just make sure that if you decide to head that route, that you have the time, effort, and your ducks in a row to be able to make that happen. We've had some pro bono legal assistance throughout our tenure, but for that and other items that, because we have a bylaws that, we had to craft. So it's a lot.
Karen? No, microphone.
I need to keep it on. Sorry about that.
That's okay.
Similar experience. So this was back in 2018, but there was a couple of us that got together, made the decision, looked through the materials on how it had to be accomplished. But we also had a pro bono attorney come and speak to our board to kind of give us some direction. So we plowed through it, and actually we're able to get it done in a couple of months. So
yeah. I remember there's a hefty price tag on that, and we decided to go it on our own instead of having an attorney do it for us.
exactly.
Yeah. Okay.
We've had to use a lot. We've had to use a lot of pro bono services for a lot of things.
Yeah, it's kind of the nature of what we do. Yeah, and we'll talk a little bit more about that as we move on. I'd like to talk a little bit about the structure of the organizations that you represent. And by that, I mean, are you run by volunteers or do you have paid staff? What type of organizational plan do you follow? Do you have a business plan or a strategic plan or some type of a business model? Or are you governed by bylaws? And how often do you revisit or update your organizational plans? And again, we'll go east to west with Greg starting us off.
All right, here we go. While this work has been evolving for a few years, 2022 is really the first year with formalized process. We secured some funding from our Division of Public Health, thankfully, and that allowed us to hire a local consulting firm to take over some of the logistics and operations of getting this thing started and off the ground. So our council and the membership of that council is the advisory board. We don't have any staff other than the contracted facilitators. So we're all volunteer at this point. And that's why I say coalition of people coming together. We don't have any bylaws yet, but we did complete a strategic planning session in February. So that will be published, and I'll make that available. And that's really where we're at now, is getting into the second year of work. We got another year of funding to help us with that. So we're going to get into governance cadence. And in my mind, I'm thinking 3 years is a pretty reasonable time to review that strategic plan.
Okay, thank you. Karen.
Yeah, our structure is all volunteers, like most of you, right? But under our 501c3 status, we did create bylaws which inform our operations. So we do have a board of directors, and it consists of 4 officers. So we have a president, president-elect, treasurer, and secretary. And those positions rotate out every 2 years alternately. So we don't have the full officers rotating out at the same time. So in addition to the officers, we have 7 members at large. So that's what forms our board. Now our board consistently has met monthly. Originally started off with conference calls, and now more recently, since the pandemic, we've of course moved to Zoom. So that's our board meetings every month, and then our full membership, we try to plan quarterly. And our board also meets once in the summertime in person. And that's when we do review our strategic plan. So We did that last summer and came up with a 1-page, and it's called a lean business plan. So it's a 1-pager, which is easy to go back and kind of look at all at one glance. So that seemed to work well for us.
Yeah. Okay. Thank you. Dory.
Okay, so we are all volunteers and we have no money. So we have no funding.
Right.
So,
Yeah.
so that's where we are. So one of the things that we're doing is we're actually in the process of putting together a survey so that we can get an idea about who in our organization. We have a lot of people. Well, let me go back. We have a community on the IHA site. So we have a lot of people who have signed up for the Michigan Health Literacy Coalition, but we haven't, not everybody has come. So we want to get an idea what people are really interested and who might contribute to some of the work of an organization. So we're in the process of doing that. We've also looked at being an extension of an organization like Greg was talking about, and other states have done. So we're kind of looking at that a little bit. And basically, I wanted to just mention too that we tried about 10 years ago to do a nonprofit organization, and went through a lot of the bylaws and things like that. And then we backed up and said, okay, now who would be, the president and the who would run this? And nobody had enough time to do it, right? So that's also part of the survey, is to look at who might have, time and ability to, because everybody's a volunteer, right? So I just wanted to mention that.
Yeah. Okay. Janelle.
Yeah, we too are a volunteer organization. So currently the partnership is led by a chair and a co-chair, and organizations become members through partnership dues. Organizations assign staff to represent them at meetings and events, and representatives in our group are generally those working within their organizations for patient education, communications, or public relations departments. And this structure may indeed change in the future as we start to reestablish ourselves after the loss of Alicia. And then in 2016, the partnership engaged more than 35 stakeholders in the development of the Minnesota Action Plan to improve health literacy. So I wouldn't say that it's necessarily a strategic plan, but it's a plan with strategies that we all try to work on throughout the year. The action plan is modeled after the National Action Plan, but tailored to Minnesota specific needs. And as I mentioned before, every year partner organizations are encouraged to commit to working on at least one of the priority areas listed in the plan.
Thank you. Therese.
Yeah, so we also are an all volunteer board, as I mentioned prior, and we run the organization following established bylaws, as I also mentioned. But we also have no money and no time, which can create challenges when it comes to bandwidth to keep the organization running, and includes even having time for revisiting or honing the bylaws to stay current with the organizational climate. So it overall is challenging to run a nonprofit, and as I mentioned, have had to use a lot of pro bono services. Those people have been great. We look to a lot of partnerships to receive funding and support, because there are a lot of organizations in Texas who are just as interested in health literacy as we are. And we are currently looking forward to the outcome of the current legislative session to hopefully be able to leverage the State Health Coordinating Council in supporting a health literacy movement across Texas, or at least helping to solidify the need for health literacy. But Karen, I would love to borrow your one-page template. I feel that sounds great.
Well,
We can make that available. We'll talk
Okay.
about that later.
Maybe a
Where you'll
plan.
find it. We'll talk about where you'll find it. Okay, let's move on and talk about involvement in the various organizations. How do you engage people in your coalition, and what does involvement have to offer to people who are part of the coalition? And something that we've talked about at OHelp is a paid membership versus friendship. What type of structure do you have along those lines? Do you have paid membership, or do you just have friends of? So again, we're going east to west, Greg.
I like the friendship. That's nice. It's good to have friends,
Yeah.
especially in this work. We do not have any kind of paid membership model, so we'll take help from anyone that will help us.
Mhm.
The basic structure is a leadership team, a smaller leadership team, which is myself, the director of our Partnership for Healthy Communities, which is kind of that existing network that was already there, and the director of our Delaware Healthcare Association, and then one of the leaders from a division of public health. So the four of us kind of act as like the leadership subgroup of that. And then
Mhm.
we have the full council, which is 19 people representing all 6 major health systems. We've got stakeholders from throughout the state, federally qualified health centers, equity leaders, community-based organizations, and the Public Health Association. So we tried to do a really broad swath of the state. We even have 2 representatives from payers, which is kind of a different lens to put on the conversation. So, so far, our consultant has spent the first year engaging with the community via a broad survey, focus groups, and interviews. So that's been a really engaging last year, trying to get a baseline. And then we've started having some side conversations with legislators to see what the landscape looks like, see where the interest is, and who our champions might be as we move to the next level.
Okay, thank you. Karen.
Okay, initially we funded our in-person meetings and our website. We had created a website for our partnership, funded that by passing the hat, right, for donations. And then in 2018, we introduced membership dues. So those are based on whether or not you're joining membership as an individual or as a partner organization.
Mhm.
And the dues for the partnerships are based on whether you are profit, nonprofit, and of course the size of your organization. But as far as offering, you know, we are constantly looking at different ways we can enrich your membership. So certainly there's networking, but I'd have to say primarily it would be through our educational opportunities. We put on statewide conferences. And then in our quarterly meetings, we try to offer some type of educational opportunity from someone in the field, sharing some of their resources and what's going on in their organizations and what's going on in their work. But so I'd have to say it's probably the educational opportunities that we use to engage or what we offer.
We offer. And certainly the networking too.
And networking,
you know, of being able to talk to somebody that's new into the field or new into the notion of health literacy, has some pretty established people to talk to and move from. Dory in Michigan.
So I think we have more of a friendship model. We don't have any formal membership. We basically have invited people that are interested in health literacy. And we originally actually came a couple of years ago. We started after a conference with Ohio and kind of pulled the people from Michigan and said, you know, who's interested in developing this. So that's where we went from there. We do have a small leadership team with 5 people on it. You know, I think that what has been the draw has been this collaboration. And I think that we actually have built a number of good collaborations across the state, that people met each other and networked and then worked on things together. So I think that's kind of been the draw. And I think we're now at the point of formalizing that a little bit more.
Okay. Janelle?
Yeah, so we really don't have a membership structure in terms of services or added benefits. Membership dues are based on individual membership or the size of the organization. The partnership offers kind of a community as a practice environment, a way to network with others working in health literacy, learn best practices from each other, get feedback on projects, engage in training opportunities, and work collectively on statewide health literacy activities. So for example, since 2017, the partnership has worked on developing annual health literacy awareness social media campaigns. So in the past, the campaigns have focused on areas such as teach back, health equity, plain language, and numeracy. And we also have held public-facing webinars and 3 statewide health literacy conferences. 2 have been in collaboration with the Minnesota Department of Health and one with the University of Minnesota School of Medicine Duluth campus, which those partnerships happened through me where I was employed at the time. And the first conference was held in 2018 and focused on engaging public health professionals. The second in 2019 focused on providers and healthcare organizations. And the third held last year was geared towards state legislators. All the conferences provided a Health Literacy 101 presentation to educate the audience about health literacy, plain language, the scope of those impacted, and strategies for addressing health literacy within their respective professions. And the first 2 conferences featured a panel presentation and interactive skills training. And then the last conference held last year for legislators showcased health literacy projects that were happening in the state and a presentation on health literacy advocacy and policy strategies. The conference basically centered around the first state health literacy awareness month proclamation that we had submitted to Governor Walz's office. And we were successful in that we had 10 state legislators and staff in attendance. And I believe in part this was due to our recruitment strategy. Not only did we email out personal invitations, but I also spoke directly to staff about the event and got the contact information for the scheduler and the legislative liaison.
I've been struck by the fact in previous conversations with you, when I asked how you got legislators involved, you said, well, we just called them up. And it was that easy. And you said, yes, we just called them up and we got to talk to schedulers. And if they couldn't come, they sent somebody, or at least they knew about us. And it's that easy. You just call them up and invite them. Therese.
Yeah, so we don't have a paid membership or benefits either. Basically, we've, as I mentioned previously, run on donations and partnerships with other organizations that have resources and or money. We have currently 9 board members. We purposely kept it small just to help make things more manageable. I guess if we ever got big or legislation ever got passed in Texas, we would grow that. But you just asked about, government relations, and we strategically select our board positions, and we have titles. So there's the education director, there's advocacy director. So the people that come into those positions generally have those types of resources at their disposal. So that helps, especially when you don't have money. And so the government relations people are the ones that, are already, as a part of their job, following what's going on in the legislative session and keeps us up to date. And then, lets us know when things are going to be heard. I run down to Austin, testify, or, whatever, educate people, educate the legislators. And so, we have all of these pro bono resources again, with, so that you have to resource when you don't have funding. So far, we've mainly had monthly educational sessions. We keep finding people to deliver those, which is great. But partly because it helps us network with more and more people across the state who are doing health literacy work, which then helps us to achieve our vision of having a culture of health literacy in Texas. And we've also held 2 virtual conferences that have been largely successful with over 200 attendees both times. And then we also have had the health literacy proclamation from our governor last October. So those are the things that we've done. Again, it's a unique challenge to sustain the organization without funding, but we managed to do so by leveraging resources.
Yeah. I like what you say about strategically thinking about what your board needs instead of just gathering anybody that you can get. Strategically think about what you need to help you advance your cause. Thank you for that. Organizations face a challenge to keep moving forward when many are relying on volunteers or people doing things for you in their spare time. With that in mind, how do you sustain your organization as you work toward advancing health literacy? Greg?
A fire in the belly, I think, is the first thing. You've got to have some serious passion for this and don't quit. The key for us, honestly, and where it really took off is securing some funding. Through our conversations and early work, the Division of Public Health leaders realized this was important and they stepped up. So that initial seed financing has really helped us with getting things moving. Because otherwise it was kind of me on the side of my normal job trying to do stuff.
Yeah.
So no surprise to me. I think for sustainability going forward, it's going to be more funding. We're going to continue to have resource development be one of the goals of the council. And also just keeping the engagement fresh and alive. So we have monthly meetings, and it is volunteer and kind of extra for everyone in the coalition. So we need to be teeing up things that they can see progress and feel good about their participation in what's happening and keep it moving forward.
Okay, thank you. Karen?
So sustaining and advancing, that is the question, right? So therein lies the challenge. So we've had our roadblocks as we've gone along, so I think what's key here is to remember that this is a community of folks who are like-minded, have like passions, and that we can be resources for one another. So you hit a roadblock and then reach out. How did you handle that particular situation? We reach out to one another. And then sometimes within our own board, the thought of having to pivot or shift, right? Marianne, you mentioned about, do we continue with a formal dues membership partnership, or do we move to Friends of OHelp? So that's one thing that we've talked about, but also shifting responsibilities, revisiting. That's why it's important to revisit our bylaws every year. In our bylaws, it says the different roles or duties of each of the officers, and maybe that's too much for the president to be taking on. So that's something that our board has talked about that we're going to address in our in-person meeting this summer. So just shifting some responsibilities in order to sustain and make sure that the duties are equitably dispersed. But I think mostly it's relying on one another and continuing to look for outreach and funding. Like Greg said, that's going to be key for us to be able to sustain, along with the fire in the belly.
And I think also looking at the work that the board members or the leaders of the organization are doing, and divide those up in a responsible way among people so that we don't scare anybody off from being involved. I think that's important too. Dory?
So I'm not sure what I could add. I agree with both of them. I think that the fire in the belly is really important. I think you have to be careful to spread the work. It doesn't do anybody any good to have one person doing a lot and then something happens to them, and then what do you have, right? So I think it's really it's important to have that fire, but find other people with the fire too, and work on kind of that equitable the equitable kind of work.
Disbursement of work. Yeah. Janelle?
Yeah, we too are limited by time and money. One thing that we've been able to do in the past is to secure graduate students from the University of Minnesota School of Public Health to help us with research and design for our social media campaigns. And I think that this has helped to foster a new generation of health literacy professionals, as well as providing help with the workload. Members have also been able to leverage their organization's staff and resources to help with promotion and advocacy. One of the main lessons learned within our organization from recent events is the need to maintain organizational knowledge and history of the organization as well as operations. So Alicia Odiamo, the founder of the partnership and sole chair, as I mentioned previously, passed away in March. And she was a dear colleague and friend of mine, and the partnership is definitely feeling her loss right now. Right now, we're looking at how we can sustain the partnership and what is the direction we want to take with the organization. So I first became involved in the partnership through a CDC fellowship program at the Minnesota Department of Health in 2012. So I was at least familiar with some of the history of the organization and offered to step in as interim chair. The first thing I did was reach out to the fiscal sponsor, Minnesota Literacy, to learn more about that organizational relationship, and connected with Goff Public about the partnership's social media accounts. Unfortunately, we cannot find anyone who had access to the partnership's website. So it looks like we're going to need to rebuild that site. I also reached out to the partnership to see who could serve as interim co-chair. Again, we want to have somebody else, not just one person leading the organization. So fortunately, Jean Metner from Park Nicollet volunteered for this role. And then moving forward, we're going to be working more closely with the Literacy Council. The new president, Anton Jones, graciously offered to help us with restructuring and updating our strategic plan. So having multiple members familiar with the history and operation of the organization is very important to the organization's sustainability, as is increasing membership and connecting with stakeholders throughout the state.
Yeah, thank you. Thank you. Therese.
So I, again, don't have much to add because everyone has said exactly what I planned on saying, but it's definitely come from dedication and passion of a few invested individuals who refuse to give up the mission and vision for which our organization stands. I have had the privilege of being the only person in the state for quite a few years whose entire job is health literacy. So I've done a lot of the foundational work myself, but you do start to get burned out, especially when your real work or your paid work starts to get more stressful or more demanding. And so it's been a struggle to keep that balance, and really, looking to partner with more organizations and others to help balance that load. I agree with the historical knowledge because we've had people come and go, and it's been difficult to keep all the resources such as the website and bank account, up and running, especially when you're like, oh, well, it was attached to his work email that he's now left and moved out of state, so be sure more than one person knows everything. So we just keep partnering locally, statewide, regionally, and nationally to reinvent ways to continue our work.
Yeah. Therese, it's not that you didn't have anything to say because others said it. You reinforced what everybody said. We all seem to be facing some of the same issues. So it's important that if you're looking to start a coalition in your state or region, that these are really things you got to consider and think about. So, thank you for that. We do have some questions from our audience. So let's start with those. First is to Karen. You mentioned the educational opportunities for members. Do you provide any kind of nursing CEUs or formal continuing education?
We did for our conferences. So we provide CEUs for our conferences, but we have not for our educational opportunities. And primarily, again, that's because of time, right? There's the process you have to go to apply, whether it's going to an outside source. When I was at my former organization, I was able to do that because I had a sidearm of my work where I was able to do that. I was a provider unit, but really just the bandwidth of time is not there to get that for those events, but for the conferences for sure.
Yeah, and we've talked about for the quarterly education opportunities that perhaps there is someone in our membership that is affiliated with an organization that could get nursing CEUs. We've had somebody get dental CEUs for it. So we do need to explore that a little bit more. And that is a way of perhaps doing it. Or if you have a set program to get nursing CEUs, like we have a set health literacy 101 type program coming up, and that might be a way of getting nursing CEUs for that also. So, okay, thank you. Our next question is, this is a great session. Thank you for sharing. I'm interested in this question around charging dues. I've worked with another member association, and a lot of the discussion around the notion of what member benefits are offered in exchange for the dues. And we've had that conversation too in Ohio. What do you get for your money? So the value proposition for the prospective member, can all of you weigh in on this?
So I have to say, foundationally, I've been in that conversation on many levels, both state, national, and internationally. And it is a difficult task to decide on, what is of value to people. And so, some of the things that we've done in the organizations that I have debated that topic with is look at other organizations that charge dues. Like I'm a registered dietitian. So looking at what the Academy of Nutrition and Dietetics offers us as members. And then, what are we feasibly able to offer to our health literacy constituents? Continuing education is always great. But what else can we offer that? And then, try to match the amount of the dues to the amount of benefits that you are able to provide.
Mm-hmm. Anybody else, Karen? Anybody else?
Nothing to add.
Okay. Anybody
If
else?
I could just throw one quick thing out there for that, since we don't have dues. Something I worry about with dues is a barrier to entry or barrier to participation.
Yeah.
So that's one consideration. And I think there's some different ways to approach dues just from other organizations I'm involved with. Sometimes it's what do you get for your money, and sometimes if it's more of like a mission membership. Like I'm gonna be a member because I believe in the mission of that organization, whether I use their services or not. So that there might be a dichotomy there. And then I also just feel like there's enough money out there swirling around in grants and foundations and corporate pockets that to put that barrier on our members or that burden on our members, it may be something that we can work around if we can find enough funding.
Yeah. I think the issue then becomes when you have an all volunteer board who does the grant writing and who does the legwork for that. So it's kind of like chasing your tail in a sense, but I like the idea of not having membership exclude anybody or keep somebody from being a part of your mission.
Yes.
Any other comments?
Yeah, our membership dues are kind of basically a sliding scale. So individual membership is a lot cheaper than organizational membership. And even within organizations, it's dependent on the number of employees within that organization. And everybody basically essentially gets the same, services and benefits. But I would say maybe one of the unsaid benefits of having your organization name attached to the partnership is then when you have our state conferences and other activities, then it's, brand or name recognition that gets put out there.
Yeah. Okay. Our next question. How do you feel about the difference in strategy and approach for facilitating a statewide health literacy effort, depending upon the size of your state? We have DE.
Delaware.
Is that Delaware? We have Delaware at just under 1 million people and Texas at almost 3 or 30 million people. Okay, who wants to address that?
Well, I think it's the same no matter what. Like it's the issue, right?
Yeah.
You're helping more or less people, but it still takes the same amount of effort.
I would guess though that I have less people to chase down than you do, Teresa.
Yeah. Yeah.
Well, I mean, and from the flip side of that, I have more people to resource than you do. So, you know,
There
we
you
have
go.
a lot of major cities in Texas that we have major medical centers and again, that reiterates why we developed Health Literacy Texas as a nonprofit that stands alone. So that we could resource all of those different major medical centers and universities. So yeah, I think it's just the mission and the passion, no matter what's the size of the state.
Mm-hmm.
I'd like to
Joy.
comment on the idea that we have a medium-sized state, except for we have a big state. So you might not think of Michigan as very big, but when you include the Upper Peninsula, it's quite large. So I think that we've decided to do a lot online so that everybody could participate, right?
Mhm.
So that's just another issue, I think, is travel.
Okay.
Yeah, that's a great point. I was just gonna say, because early on, our meetings would always be held at the Literacy Council, which is in St. Paul, Minnesota. And so that kind of was a barrier to other folks that, you know, came from greater Minnesota. So I think, you know, the pandemic, as bad as it was, it's, you know, forced us all into the virtual environment, and that's been very beneficial to having greater statewide representation.
Yeah, yeah. Have any of you partnered with organizations such as the National Library of Medicine or the Network of the National Library of Medicine for funding or educational opportunities?
I have. So we've got, well, I can't say we, I have gotten, and so really some of my partners. So I work with another local university here and then people in other departments within my university, and have gotten grants to develop many of the health literacy tools that I've developed. So our WebLit Legit toolkit, which is basically a digital literacy toolkit, is funded by the National Library of Medicine. We have a toolkit to help organizations become health literate healthcare organizations or develop organizational health literacy, which is on the Health Literacy Texas website. It's called Innovate to Communicate. That was funded by the National Library of Medicine. We've developed several continuing education modules for community health workers to upskill them that were all funded by the National Library of Medicine.
Okay, good. Doris, this one is for you. How do you capture the collaborations and resulting outcomes? Do you capture it formally in any ways?
I think that's a wonderful idea. We have not done that, but it would be good to do that. It's we have a lot of members that are like a variety of members that are, for instance, we have people from the Michigan Poison and Drug Education Program, and you know, people that are not necessarily providers. So I think that's helped kind of do some of those collaborations. Plus, we have a lot. We also have Janelle talked about interns. You know, we do have students and that have worked on some of these things as well.
Okay, thank you. Here's an interesting one. This is an interesting question. What are your thoughts of having dues fund a scholarship or something similar that will go toward a literacy project? Anybody thoughts?
I mean, the only thing I can think of is, I mean, that would be a benefit and you could feel like you were part of something if your dues did go to that work. being the, queen of shoestring, making things happen. At first I was like, oh, it usually takes a lot of money, but no, really, you can do some great work with no money. We've done it before, with one of my local collaboratives. So, yeah, I mean, it's an interesting thought, and I think it definitely could give people a reason to buy in. So yeah, let's consider it.
I have ideas going already. It's an interesting way of looking at something. I have found that even if your membership dues are $25, people want something for their $25. They need something tangible. And this might be, it's a way of offering people something. It's an interesting idea. I have one last question here. Any resources for how to get involved in similar health literacy coalitions like yours in our own state of Chicago, Illinois? Lydia Byrne.
Well,
So
I think that,
go ahead.
no, I think that, just with the IHA Solution Center, posting on there, posting on the listserv, that you want to meet up with different people in your states. There's opportunities in a hub to do that, to connect, reach out to any one of us to get an idea of how we got together. Might be a starting point.
Yeah. Any other suggestions?
There's also the CDC website of health literacy activities by state. I don't know off the top of my head if Illinois is on there, but that'd be a place to start and then reach out to whoever's on.
Yes, that is a good place to look. I don't know if they're there or not either. That is it for our questions. So we're right on time. Let's talk about summary and next steps to all of the panelists. What advice would you give to, and this kind of addresses this last question, what advice would you give to someone thinking about starting a health literacy coalition in their state or region? And
is very important. I would say that one of the things to be aware of is to not make plans beyond what is the capacity of your members, of what the people that are available, or find more people. That's the other thing. You could find other people. And really finding other people is an important thing, but I would say start slowly, and look for what other people have done.
Okay, thank you. Janelle. No, I'm sorry, Greg. Greg, I'd like you to go next.
Okay. My advice to someone thinking about starting out is just do it. If you don't do it, who will?
Yeah.
So step up and be the person. It won't be easy, but my advice beyond that would be to find leadership inside your organization that will support your efforts to do that. And then find some folks on the outside of your organization to help you as well. Those leaders can really do a lot for you.
Yeah. Janelle.
Yeah, so I would say think strategically and start building your team. Start out as, starting out as a volunteer organization, your team will have limited time to work on health literacy activities. So you have to think about activities that are going to have the greatest impact and visibility. Organizing a conference, a summit, or some type of event, for example, will give your organization lots of visibility. Then you need to think about ways to keep the momentum going beyond the event. We as health literacy professionals have a tendency to promote health literacy in the month of October, and I think that's a great start. But we need to be thinking about ways to promote health literacy throughout the year. If you're leading the organization, it's important to touch base individually with your members, find out where they're at on their health literacy journey and what supports they need to advance their work and what ideas they have for the organization. Hopefully this will ensure that you have a captive and engaged team. Also actively reaching out to different professions and organizations to recruit and diversify your team would also be very important.
Yeah. Therese.
Yeah, I just have to reiterate again what everyone else has said. I like, as I mentioned earlier, we do recruit and diversify our team, and just by nature of how we structured the positions. But I would also, and what we're continuing to do is network and partner with others that are as passionate about this work as we are. I would definitely go back and do differently the development of the bylaws and the formal structure of the organization. So do all of that foundational work before you get started, because then you get in the muck of it and people are like, well, what's the policy on that? Or what, and you're like, we haven't thought about that yet, so be organized is my biggest advice, and don't surpass your own capacity, because we did that and had to step back and slow down.
Therese, as a result of our discussion, what are the next steps that you would like to see happen?
Well, basically, as others have mentioned, is just more collaborative work across the state, so that you're spreading that work out, and it's not just the hub of the board of directors, and then more networking and support, nationally, internationally, among the states and regions. I'm on several different groups that meet on a regular basis to talk through issues and work that's being done. So that's really helpful and supportive.
Greg, what would you like to see as a result of our discussion today?
Yeah, the same thing. I mean, I think this is great. Honestly, I wish when I was starting out that I had a session like this to attend and get some ideas from. So I think the more we can standardize our approach and coalesce around shared strategies, that's going to be a strength.
Okay, Karen?
Yeah, I agree that we need to raise awareness more nationally. And Therese mentioned and Janelle mentioned, there's different organizations like regional networks of health literacy experts. And from those networking, we've been able to do some good work. Number one, I know Dr. Cliff Coleman yesterday talked about health system accrediting agencies such as the Joint Commission should set practice standards. And that's one thing a group of us worked on for over a year, trying to work with the Joint Commission to elevate health literacy as a national patient safety goal. Now, most recently, they raised health equity, which is a good thing because we know we can't have health equity without health literacy. But the other thing nationally, I wanted to throw out, Dr. Janelle Lamont here has leading the efforts of promoting October as Health Literacy Month nationally. So we did send a proclamation language, actually proposal to the White House, and are waiting to hear back from that. So hopefully having an event, media policy event in October to announce the signing and do short programming on health literacy with policy stakeholders, National Association stakeholders. So really trying to increase that national discussion around our work.
Well, unfortunately, our time is up, but I want to take the last minute to announce that we have started a special community on the IHA Solutions website, specifically for people wanting to start health literacy coalitions. This new community is called the Coalition Development and Advocacy Hub. We see this new community as a place where we can store examples of information like toolkits or job descriptions, bylaws, strategic plans, marketing plans, things like this. Members will be able to start discussions and pose questions of other members. So please join our Coalition Development and Advocacy Hub. You can do that by going to the IHA Solutions website and log in. And then you go down and you click on the Connect tab and then click on Community Portal. From the Community Portal, you scroll down and click on the Coalition Development and Advocacy Hub. Make sure that you choose your preference for receiving emails so that you do get emails, and then click yes to join. Now, I've already posted the contact information for all of our panelists, and if you have additional questions, All of our panelists are more than happy to talk to you individually. Thank you, IHA, for setting this up. We appreciate it more than you know. I'd like to thank you all for joining our discussion. I hope you found it useful. Thank you also to the panelists. Your experience and insights are invaluable. I appreciate you all and all that you had to share. Thank you so much for indulging me in this. Bye for now and have a good rest of conference.
Hi, Marianne. Can I just quickly say Monday, October 2nd is our National Health Literacy Awareness event. We hope to have the proclamation in place, and we're going to have some really great speakers. So if you need to have more information, you can contact me or also reach out to Karen. Thanks.
Okay. And their information is on the new Community or Coalition Development and Advocacy Hub. Thank you all for joining. Bye-bye.